Thank you very much, Chair. Chair, members of the committee, I welcome this opportunity to update the Special Committee on Ireland's ongoing response to COVID-19. You've heard earlier today from the HSE, from the Acting Chief Medical Officer, Dr. Glynn, and from Professor Nolan about Ireland's operational response to COVID-19 and the prevalence of the virus in our country at this time. I'd like to take this time, therefore, to update you on Ireland's approach and the priorities from now until Christmas. Earlier this year, Ireland and countries across Europe locked down as COVID spread relentlessly through our communities. Around the world, tens of millions of people have been affected and hundreds of thousands of people have lost their lives. Many lives have been lost here in Ireland as well, and we mourn every single one of them. It's been a very difficult year for everyone and absolutely heartbreaking for those who've lost family and friends due to COVID-19. People across the healthcare system have worked tirelessly to prepare an already overburdened health system to cope with COVID-19. The people of Ireland worked every day and sacrificed much to comply with the lockdown, keep essential services running, and to flatten the curve. As countries across Europe began to open up, COVID-19 started to spread again. Countries across Europe are now acting to suppress the virus, and here in Ireland we are doing the same. The first chapter in our fight against COVID-19 was focused on flattening the curve. The country was locked down. Schools and colleges were closed. Businesses were closed. Much hospital and community care was stopped. People isolated by staying at home. Sports, arts and community activities were cancelled. This approach did flatten the curve, but as we all know, it came at a huge cost. We're now in the second chapter of the fight against COVID-19. From now until at least Christmas, our focus is on suppressing the virus to allow us reopen society, reopen schools, reopen colleges, reopen health services, protect jobs, and protect those who are most vulnerable to this awful virus. Because we know more about the virus now, it has been possible to bring in localised measures where cases grew locally. And it's been possible to bring in national measures as necessary to limit the suppression of the virus through targeted national measures. Because tens of thousands of tests are being done every week, it's been possible to act quickly and to suppress the virus as it tries to move once again through our communities. Last week, we learned something very, very important. Thanks to the amazing efforts of the people of Kildare, Laois and Offaly, we know that localised measures can work, and it is without a doubt that the people of Kildare, Laois and Offaly have saved a lot of lives. They've saved lives in their own community, and by helping suppress the spread of the virus around the country, they've saved lives all over Ireland, and for that we owe them a debt of gratitude. We know that measures that avoid lockdown by seeking out and minimising the situations in which the virus spreads are what we now want to use. That's the approach we're using across Ireland. Targeted measures to suppress the virus while keeping as much of our society and as much of our economy open as possible. In my own department, in health, we are preparing for the winter. A comprehensive winter plan is being developed and many measures are already in place. As has been the case from the first day COVID arrived in Ireland, government decisions are informed by the recommendations and advice of the National Public Health Emergency Team, NPHET. NPHET monitors the evolving evidence both here in Ireland and around the world. They in turn are guided by recommendations of the World Health Organization and the European Centre for Disease Prevention and Control, and we are grateful for their assistance. Chairman, members of the committee, thank you for this opportunity, and I look forward to a good discussion with you in the coming hours on COVID-19.
Thank you very much.